Hi, my name is Thomas Galvez-Reed, and I'm a clinical application engineer with Solventum. This video is intended for healthcare professionals. Before we begin surgery, we may be familiar with some of these steps. First, we'll apply a surgical prep to reduce the microbial count on the skin as much as possible, knowing we cannot sterilize skin. Then we will place surgical drapes around the site to create our sterile field. This is sometimes where people stop, but it's important to complete the next step, if possible by applying an incise drape to create a sterile surface prior to beginning surgery. This is a great graphic to illustrate how surgical preps and 3M Ioban 2 antimicrobial incise drapes work. On the left side, you can see how surgical preps work on the skin surface and penetrate to the skin layers of around 300 microns. We can see how hair follicles reside in the deeper layers of the skin around the 1000 micron level. We know we cannot sterilize the skin, and the remaining microbes will continue to reproduce, and microbes hiding in the deeper layers can emerge to the skin's surface. While surgery is progressing, these microbes on the skin can be picked up by sponges, gloves, and instruments, and then carried into the surgical incision, giving an increased risk of surgical site infections. On the right, we can see Ioban 2 is placed over our surgical prep, preventing our prep from being washed away. The incise drape creates a sterile surface at the beginning of surgery. It immobilizes any residual microbes left on the skin surface, so they can't easily be picked up by instruments and gloves and transferred into the surgical incision. There's 2% iodine built in the adhesive of Ioban 2 that has been shown to penetrate as deep as the 1000 micron level where hair follicles reside. The 2% iodine in Ioban 2 provides broad-spectrum antimicrobial activity to help reduce the risk of surgical site contamination, which can result in surgical site infections. The Ioban 2 incise drape also holds other drapes in place, reducing drape shift contamination during the procedure and eliminating the need for towel clips or clamps to hold the drapes in place.